It is the voice of Indiana County, WCCS, AM 1160, 101.1 FM. And on the line with us here this morning is Mark O'Brien, who is with the Addiction Policy Forum. And, we think about the battle against opioids and the crisis that has come, and all kinds of different angles for attacking it. And the Addiction Policy Forum is one of those. Mark, good morning.
Good morning, Todd. Thank you so much for having me on.
I'm glad you're here with us. We have, as so many counties do around our area and around the nation, a real problem with opioid addiction. And there is a program that is going on here in Indiana County that is actually a state program that originated here. It's called the Warm Handoff Program, and your organization, through its Spotlight series, recognized it last week. Tell me about that.
That's right, Todd. Through our Spotlights program, we really try to highlight programs throughout the country that are responding to addiction and showing some promising results in the areas of prevention, treatment, recovery support, criminal justice, law enforcement, child welfare. And the Pennsylvania Warm Handoff Program, and as you said, it's modeled on work that was already underway in Armstrong, Indiana, and Clarion counties, is one such program that is really, from my perspective, a terrific step forward. And we're dealing with a crisis when it comes to opioids, with addictions and overdose. And one of the places where this is felt really acutely is in our emergency departments. Throughout the country, we've seen just in the last decade that emergency department visits related to opioids have more than doubled. And this is a place where, and because of the way this disease affects people's brains, a lot of people aren't getting other health care besides when they show up at the emergency department with an overdose, acute withdrawal symptoms, infections related to their addiction. And in a lot of cases, it's been a big missed opportunity to connect people with services that could improve their health in the long term. The emergency department isn't always set up to do that. It's responding to the really acute crisis at hand. We're talking about saving people's lives from overdoses as the primary concern in the emergency department, but we also know that's a great place where we could intervene with people and get them into those long-term services. It's something that a lot of emergency departments and hospitals are grappling with around the country. And so I think it's wonderful that Pennsylvania has this Warm Handoff Program, and I'm rambling on, but would love to tell you a little bit about it. Pennsylvania's Warm Handoff Program requires all county offices that provide drug and alcohol programs to set up protocols for people when they come to the emergency department with an opioid overdose to get connected with treatment in the community. It's a great model in Pennsylvania, and one that we're hoping is going to get replicated throughout the country.
Yeah, well, it's a real what next step approach, isn't it?
That's exactly right. And when it comes to things like heart disease and you come to the emergency department with a heart attack, no hospital in the country is going to let you leave that hospital without connecting you to a cardiologist. And so the goal is, in the long run, to have that same kind of systematic approach to patients and that ongoing continuum of care for patients who have opioid addictions.
Yeah, we note that the Warm Handoff Program combines with other programs to address this problem, and because of that, it's kind of hard to say, okay, well, Indiana County sent this many into Warm Handoff, and Clarion County this many, and Armstrong County this many, but that's really not the goal of the program anyway. It's to be sure we get people into treatment who really are in need of it. And in many cases, it's difficult to convince them of the need to go further. So that takes a real dedication on the behalf of those who are actually doing that.
You're 100% correct. Again, because of the way this disease impacts the brain, but also because of the way people feel after an overdose. When you're revived from an overdose with naloxone, a lot of times that's going to put a person immediately into opioid withdrawal if they have an addiction. This is an incredibly uncomfortable and painful experience, and for a lot of patients, the top priority is to get out of the hospital and unfortunately to seek out the drugs that are going to make them feel better in that instant, but it really puts them at a pretty high risk. And I think we're really fortunate to have healthcare providers in this country, doctors, nurses, peer recovery support specialists, case management people who are dedicated to solving this problem, and I think it takes a really compassionate approach to talk to somebody and make them feel more comfortable and convince them that it's time to look for a solution to their problem.
So when the Addiction Policy Forum literally shines a spotlight on programs like Warm Handoff, obviously you're looking for feedback to that. What has the feedback been?
It's actually been overwhelmingly positive. One of our projects is an emergency medicine initiative where we're working with the American College of Emergency Physicians, Yale Emergency Medicine, to highlight some of these promising practices and provide learning collaborative opportunities for different hospitals that are looking to also address this problem of patients coming into the emergency department with opioid use disorders or overdose, and what to do next with them. And we're also providing some technical assistance to individual hospitals as they implement new procedures and protocols around these patients. And of course, one of the first things we did with this was to circulate it to those folks. And it's been very positive. People, I think, one of the challenges is that a lot of the hospitals are just trying to figure this out on their own, or looking to groups like ours or other groups to help them figure out what to do. But the nice thing about the Pennsylvania program is that the state actually provided some model protocols, but also some flexibility so that the hospitals have some options for how they can implement this and some good models that'll work for them.
So when people do get back to your organization, the Addiction Policy Forum, and they say, well, we read that, we saw all the information about it, it really looks cool, how do we implement it? Obviously, you have the ability then to put them in line with the people that they need to talk to.
That's exactly right, and that's what I think we all have to be thinking about all the time, and especially when we're in a crisis like this, is not just how we can talk the talk, but how we can walk the walk and make the connections that people need to be able to make a difference.
Yeah, absolutely. So tell me a little bit about the Addiction Policy Forum. How long has it been operating? And I'm sure that it has its own measures of success for the program itself. What's it been like?
Yeah, absolutely. So we're a pretty young organization. We just celebrated our third birthday earlier in the summer, but started by our founder and CEO, Jess Nickel, who's been in this field for about 20 years, and we really bring a deep personal passion to this work. Jess was very personally impacted by the disease of addiction as a young person. Two parents with heroin use disorders, and for her that meant at different times in her life she was taking care of a sister when she was too young to have that amount of responsibility, homeless or in foster care, and ultimately lost her parents sooner than she should have. We have a big network of families who have been impacted by this disease, whether they've lost children to overdose, themselves experienced an addiction and found recovery. And so this is really personal for us. And one of our programs is the Spotlight program, where we're highlighting innovative programs throughout the country, also providing technical assistance to state and local governments to implement new policies. And I think the Pennsylvania Warm Handoff program is actually a good example of both of those, where we're talking about a program that's working well in a number of hospitals, but also one that came about through changes in public policy. Doing some advocacy work in D.C. on some of these opioids packages, and generally really thinking of ourselves as an organization that's led by the families that we represent, and always seeking their input on what it is that we should be working on.
We tend, of course, in this area, in Indiana County, to focus upon the problem in Indiana County, and we might lose that ability to get a real idea of the scope of the problem nationally. But this really is a national problem that has so many deep local roots that it has to be tackled in that way, doesn't it?
Oh, absolutely, Todd. I mean, we're talking about, with the opioid epidemic, something that is costing us nearly 200 lives every single day. And I have a public health background. We think a lot about the data. It's how we know how big a problem is, whether what we're doing is working to solve it. But when I hear those numbers, 200 people a day, I always have to remember, we're talking about 200 people who are somebody's child, somebody's mother or father or brother, or neighbors and friends. It means that in this country, every single day, 200 people have a newly empty seat at their dinner table. And this is an all-hands-on-deck kind of situation where we all have to be a part of the solution.
It's amazing, because I was thinking those exact words, empty seats at the dinner table, before you said them. And that really brings home how personal this problem is and must be. Programs like Warm Handoff, of course, they're addressing that. Mark O'Brien, thanks so much. Continued success with the program.
We appreciate that, Todd, and really appreciate you having me on.